Good morning, everyone, respected teachers, dear colleagues and friends. I'll be presenting the updated 5-year survival data and genomic analysis of patients with BRAF V600E mutant metastatic NSCLC, a phase 2 study of use of Dabrafenib and Trametinib in these patients. This study was published in January 2022 in the Journal of Thoracic Oncology. We all know that BRAF V600E accounts for around 1 to 2% of the patients of adenocarcinoma lung, and we also know that Dabrafenib-Trametinib combination works well over here. This is just an updated survival analysis at 5-year time point. Sorry. So this was a phase 2 study, multi-cohort, multi-centric, non-randomized open-label study. More than 18 years of age, performance status ECOG 0 to 2, with BRAF V600E mutation positive patients were enrolled in this study. This had 3 cohorts. Cohort A had received only Dabrafenib. So in this particular analysis, those patients have been excluded. The cohort B patients were patients who had received at least 3 lines or up to 3 lines of systemic therapy in the form of some chemotherapy or some other immunotherapy agents. And cohort C was of patients who had not received any systemic therapy before getting enrolled into this study. All these patients in the cohort B and C received Dabrafenib 150 mg twice a day and Trametinib 2 mg once a day. The primary endpoint of the study was overall response rates as assessed by the investigators, and the secondary endpoints were duration of response, progression-free survivals, and overall survival and safety analysis. Going straight to the results, the study enrolled around 93 patients in the between December 2013 to January 2015. 57 patients had received some form of previous systemic treatment, so they were enrolled in the cohort B, and 36 patients were enrolled in cohort C who had not received any previous line of treatment. The median follow-up for both the arms was around 16.5 months. The overall response rates were 68% and 63%, 64%. So again, both the arms did almost equally well. As compared to single agent Dabrafenib, where the response rates were 33%, there was a doubling of the response rates by addition of the MEK inhibitor Trametinib over here. So this is the here we can see the overall response rates. Around 5 to 6% of patients had achieved complete response with the combination in pre-treated subgroup as well as treatment-naive subgroup, and around 60% of patients achieved partial response, with an additional 10 to 11% of patients achieving a stable disease. So a disease control rate of around 80% and a response rate of around 66 to 69%. The duration of response in both the subgroups, in both the cohorts, the median duration of response was around 10 months. The progression-free survival in both the groups was around 11 to 12 months in pre-treated patients as well as in patients who had not received any treatment. The overall survival also was almost same in both the subgroups. It was 17.2 months in the patients who received the treatment de novo, and it was 18.6 months in the patients who had received previous lines of treatment. This was the median overall survival. Coming to the 4 and 5-year survival rates, which was the new data which was published in this particular study. So 26% and 19% in the pre-treated arm had an overall survival. This was the overall survival rate in patients who had at 4-year and 5-year time points, while 34% and 22% in the treatment-naive patients were still doing well at 4-year and 5-year time points. 18% of the total patients, so 17 out of the 93 patients were still alive at the 5-year time point of data cutoff. So the data cutoff was in February 2021. So, and the most frequent adverse events were pyrexia. We all know that Dabrafenib-Trametinib combination, one of the most common side effects is pyrexia. The other common side effects seen were nausea, vomiting, diarrhea, and peripheral edema and decreased appetite. Overall, a well-tolerated combination, I'll say, but almost 48% required Dabrafenib dose reduction, 33% required Trametinib dose reductions, and they could continue the treatment with these dose reductions overall. Coming to the second part of the analysis, the retrospective genomic analysis, which was done to look for whether there are whether concurrent genomic alterations or other mutations in the patients are affecting the overall survival rates or progression-free survival rates. So around so out of the 93 patients, this was a retrospective analysis. So around 88 patients blocks could be retrieved and were analyzed with the Oncomine diagnostic NGS platform of a Thermo Fisher platform. And of these patients, 22% of the patients had concomitant other genomic alterations. This is the chart showing the other concomitant genomic alterations. So KRAS mutations, PIK3 mutations, MET mutations, these were, and IDH mutations were seen. Amongst these, the patients who had PIK3 mutations, some of them had very poor survivals, like the progression-free survival seen in 2 of those patients were as less as just 1.4 months, and the overall survival was also just 3.1 months or 3.8 months. So what the authors concluded that probably PIK3 pathway concomitant mutations are a driver, are a prognostic factor for a poorer overall survival in this subgroup. But as the number is very small, it cannot be concluded with a strength. So more studies or more investigation needs to be done in this particular group of patients. So in conclusion, yes, we all know that Dabrafenib Trametinib combination brings about a substantial and durable clinical benefit in patients with BRAF V600E mutant metastatic non-small cell lung cancer, regardless of the previous treatment. So with that, I thank you for your attention. Thank you.